Hello. Today we will discuss the dilemma of understaffing nurses in hospitals across the country. As more Americans gain access to health care, nurses are required to care for more patients and offer the same quality of care. But we will soon discover why that is an unrealistic expectation, how nurses have responded to the dilemma, and how we as patients can best support them. Since 2001, the nursing profession has advanced significantly and is now the nation's largest healthcare profession, with more than 3.1 million registered nurses nationwide. Of all licensed RNs, 2.6 million, or 84.8%, are employed in nursing. Nurses comprise the largest single component of hospital staff and are the primary providers of hospital patient care and deliver most of the nation's long-term care as well. To meet the more complex demands of today's healthcare environment, the National Advisory Council of Nurse Education and Practice has recommended that at least 2/3 of the basic nurse workforce hold baccalaureate or higher degrees in nursing. As of 2008, 13.2% of the nation's registered nurses held either a master's or doctoral degree as their highest educational preparation. Through every era, the nursing field overcame many challenges. According to a 2002 report by the Workforce Commission of the American Hospital Association, the country has a nursing shortage that reflects fundamental changes in population, demographics, career expectations, work attitudes, and worker dissatisfaction. A federal government study predicts that hospital nursing vacancies will reach 800,000, or 29%, by the year 2020. The number of nurses, however, is expected to grow by only 6% by that year, and the demand for nursing care is expected to grow by 40%. In 2002, the Journal of the American Medical Association published Linda Aiken's most notable research, in which she studied 10,000 nurses in 168 hospitals. Her work revealed that for each additional patient assigned to a nurse, 30-day patient mortality increased by 7%, failure to rescue rates rose by 7%, the odds of nurse job dissatisfaction increased by 15%, and the odds of nurse burnout increased by 23%. Even after Aiken's research, according to a study done by Staff Care in 2013, nearly half of all nurses care for between 11 and 20 patients per day, while the average number of patients seen per day is 17. However, 1/3 of nurses see more than 20 patients per day. This means that nurses are caring for more patients per day than they should be. Although alarming but not surprising based on the information just covered, a 2013 study in the Journal of Patient Safety estimates that between 210,000 and 440,000 patients die at hospitals each year as a result of medical errors. Medical errors often occur when a nurse is exhausted or is not given the authority to make critical decisions. Additionally, a 2011 survey of 95,000 nurses found that 36% of nurses in hospitals believed that their workload caused them to miss changes in their patients' conditions. According to a survey done by Staff Care in 2013, although 81% of nurse practitioners described themselves as overworked, 96% stated that they would choose to be a nurse again, and 97% would recommend their profession to young people. Although employees in the field are historically overstressed, nurses continue to work long hours and are generally satisfied with the care that they are able to provide. As hospitals work to balance the nurse-to-patient ratio, as patients, we can help reduce nurses' stress. First, speak clearly about your symptoms or changes in your condition utilizing plain English. A concise explanation of your symptoms will allow the nurse to provide the best quality of care. To conclude, be appreciative of the care that your nurses provide and display patience as they care for many patients.